been a lot of talk lately about another topic, that stubborn parasite that's making a lot of people sick. It is during an outbreak that continues to spread across the country.
So the source is called cyclospora, the illness cyclosporiasis.
Well
Dr. John, thank you. Dr. John Hu with the Jacobs School of Medicine and Biomedical Sciences is now here to explain. This seems to be everywhere, whether you are discussing it or seeing it on social media. How aware do people have to be? Is it here in Western New York? Could it be here? Do we not know? What, can we just start out right there?
Sure, absolutely. Marley, great questions, and A+ in the pronunciation, by the way.
Thank you.
And so, this is a diarrheal illness that we have seen in years past, and so has a seasonality typically from spring until summer. But the unusual case number of this year has been the point of concern. And as of right now, health officials do not have a clear source. People typically get this infection from consuming contaminated fresh produce, uncooked produce, that is. And so vegetables such as lettuce and fruits such as raspberries have been culpable in the past, but as of right now, we don't have a clear source. Now, fortunately for us in Erie County, we do not have any official cases so far. However, there are instances where case counts can be delayed. For example, symptoms may present later on, and so that doesn't mean it's not here. However, it is a problem right now in the United States.
Complicating matters you just kind of touched on is the fact that this can be dormant in someone for at least a period of a week, maybe even up to 2 weeks, so it's difficult to track. So can you talk a little bit about that sort of latency period and how that can be a challenge for health officials? And then what are some of the early symptoms that people might need to be? Obviously, we know the major symptoms. If you're rushing to the bathroom back and forth,
That's
you know
right.
that. But is there anything that might be a precursor that folks might need to pay attention to?
Yeah, you're absolutely right. So part of the delay in symptoms is a real challenge. And when you think about tracking what foods people have eaten, having that recall potentially up to 2 weeks
Right.
is a major problem. In addition to this, typical testing that we think about looking at stool may not often pick up this parasite. And so the provider that's testing the patient may have to request special testing to get this. Now, in terms of symptoms, as you said, diarrhea can be quite severe, and people have called this explosive at times because of how suddenly this comes on. Other symptoms include loss of appetite, for example, and abdominal cramping. And I think, the majority of people that end up in hospitals, for example, are those that experience dehydration from these symptoms. And I always tell people and my patients specifically that if you have symptoms for more than several days, in this context, in the current outbreak, please seek medical care and get testing.
For people who may be experiencing symptoms, I can imagine it might be difficult to decipher, okay, is this regular GI? Do I have a stomach bug?
Right.
Or is this cyclosporiasis? But I can imagine if you are experiencing for any amount of time that you should seek medical advice.
Correct. I think in this current climate where we're having outbreaks, symptoms lasting more than 24, 40 hours should seek medical attention. I think this is for twofold. One is for case detection, but two, those that have symptoms, and especially those that have weak immune systems, would benefit from treatment. And so unlike some of the other diarrheal illnesses like norovirus, we actually have antibiotics that are able to treat this disease. And so with testing and treatment, we expect a much better recovery from those affected.
Dr. Hu, you mentioned that this in the past has been kind of a cyclical or a seasonal illness. Do we expect that to happen again this year? So maybe it comes to the end at the end of the summer. And also, why, or are there any theories about why it's worse this year than maybe in years past? Yeah,
that's a great question. I mean, the typical time frame is between May and August, and outside of current information, we don't expect this to last much longer. But I think one of the reasons we've thought about why caseload is higher is potentially some of the weather changes we've experiencing. And so when the eggs that are shed from those that are infected, they have to dwell in the environment for several weeks. And increasing temperatures, heat, humidity, these all increase the amount of oocysts that may mature. And so this is a potential theory. But of course, without having a clear identified source, these are all hypotheses. And
so what can people do? For many people, this is a majority of their food groups that they go to, especially this time of year. You want to have, like a fresh salad. Is there a way that you can still partake in vegetables or fruits.
Still have your salad and eat it too.
Without being worried.
Right. And of course, people have come to me and said, should we just stop eating fruits and vegetables altogether? And I think that's a really challenging thing to say, especially given the nutritional benefit of eating fresh fruits and vegetables. I think you have to think about the risk in terms of who you are as a person and what your tolerances are. So there are some definite precautions we can do. So for example, really washing your leafy greens, and especially if you buy a head of lettuce, taking off the outer leaves. And one of the unusual characteristics of this type of infection is that chlorine and other compounds are not able to kill the oocyte of the parasite. And so running things under large amounts of water is able to help at least reduce some of that risk. And I think for those that have weakened immune systems, I have recommended to my patients, say, during this time, perhaps consider cooking and changing some of the recipes you eat. And certain fruits, such as raspberries, for example, are hard to wash with all the nooks and crannies, whereas things like bananas or citrus fruits, you can even take the peel off, may be able to reduce the risk. So for now, I think you can do a lot of these approaches to try to reduce the risk without taking out these food groups completely.
Really great advice. Dr. Hu, thank you so much
Absolutely.
for joining us. This is something that a lot of people are definitely paying attention to.
It's my pleasure.